Paul Finucane, welcome. Paul is a retired physician and geriatrician, has an interest in mentorship for medics, but most particularly in mentorship for international medical graduates. Paul himself was an Irish graduate working in Yemen, Wales and Australia for large portions of his career. He has been very involved with the medical school sector and was a member of the Irish Medical Council until 2023. So Paul, thank you very much for agreeing to today's interview. Can I begin by asking you, why are you so passionate about mentorship?
Yeah, I'm not sure if I use the word passionate, John, but certainly I think it's an important issue that has been neglected in the Irish healthcare system. Again, you've mentioned, but just to elaborate on what you said already, I've spent 25 odd years of my career as an international medical graduate, a couple of years in Yemen, Arab Republic, 6 years in Wales, working in the NHS, and 15 years in Australia. So I've been an international medical graduate for much of my life. I suppose I've had the advantage of working in healthcare systems that were broadly familiar, but I didn't have the challenge, other than in the Middle East, of a different culture or much different culture and language issues. So in many ways, I had an easy IMG experience. But having said that, I mean, it's still quite a challenging thing to move country and all that goes with it. And then the second thing is that I have served on the Medical Council and in fact been employed by the Medical Council on 3 occasions over the years. So I've had a fair bit to do with the regulatory process, and particularly with the complaints made against doctors through my involvement with the PPC, the Primary Preliminary Proceedings Committee of the Irish Medical Council. I felt that some kind of an intervention early on in the piece would prevent a lot of the problems that surface with IMGs and that cause them to be complained to the IMC. And I suppose a third element to all of this is I've seen elsewhere how interventions, and particularly mentorship programs, can make life so much easier for all IMGs, and particularly can prevent, the really awful things that can happen when situations go off the rails.
Okay, there's kind of a lot there that we might try and unwrap over the next few minutes. But maybe before we go too much further, just so that we're kind of all speaking the same language here, can you maybe describe in your own words what you mean after kind of this career in lots of different parts of the world? What do you mean when you talk about mentorship?
Yeah, I mean, I think, sometimes we make life complicated, and I see it in very simple terms, John, as essentially a system that provides some guidance and some support to a medical graduate who's arriving in a new country, in a new healthcare system. And I think those are the two key words: guidance and support. I do think it needs to be kept simple. I mean, I've clearly been mentored myself, and I've tried to mentor people as I've gone through my career. But the mentorship processes that have worked best for me have been somebody that I feel that I can go to just to run ideas by and get advice. Maybe somebody who has a greater level of wisdom, perhaps even greater knowledge than I have in certain areas, and get their guidance and get their support. So again, maybe just to say, and we're starting to go off on tangents, so my apologies, but I think this does exist at some level on an informal basis for just about everybody. I mean, we all have people, or should have, that we can go to when we need some support, when we need some guidance. What we're talking about here is something that's a bit more formal, that it's not just left to chance, that there's a structure in place.
I think you're right. I mean, I think in Ireland there has been a very strong tradition of mentorship, but I suppose the challenge is, scaling that, because it's often relied on chemistry between two people rather than it being programmed or planned in any particular way. So I think the challenge is how do you reproduce that chemistry, but in a planned way. So I mean, I guess what's interesting is that the scope of what you view as being successful mentorship is much broader than what could be defined by a curriculum. I mean, we're very used to the idea of educational supervision and, is somebody meeting their various curricular requirements, but this is much more human, and it's quite holistic, isn't it?
Absolutely, without question. And I do see a very clear difference between educational supervision or trainee supervision and mentorship. When I've been myself in a role of a clinical supervisor, the focus always is on the service you're providing and on the patients that you're serving, and certainly the role of the IMG in that system. But the IMG is not center stage. The IMG is one of the jigsaws in putting together a system that works well for the institution and for the patients. Whereas I think with mentorship, the focus is very definitely on the IMG, and I think it's very hard for somebody to actually serve as an educational or as a training supervisor and also as a mentor, because there will inevitably be competing priorities. So during the role of a training supervisor, you have to focus on one particular dimension of this person's, personality or work practices. If you're a mentor, it's a very different kind of mindset when you sit down.
And I guess from the mentee's perspective, if your mentor is also an educational supervisor, your likelihood of disclosing difficulties that you're having, when potentially it may then impede your progress to training, is I think that seems to be a really important thing. I suppose getting back to that challenge of kind of planning or programming mentorship. In your travels, have you seen good examples of mentorship programs?
I think, again, because the bulk of my career has been spent in Australia, I naturally look to Australia as being the place where I have seen mentorship programs that have worked. As I mentioned earlier, the regulatory body, the Australian Medical Council, has taken the lead quite some years ago. That's been taken up by the postgraduate training bodies and by the Australian Medical Association. And there's now a very strong mentorship program in place in all states in Australia. So again, not everybody chooses to participate. Not everybody gets, but at least there's a system there that works for people. Absolutely. Okay. And again, it's not rocket science, John. It's not enormously resource intensive. It's not enormously costly, but it does mean that there is a formal system whereby an IMG is paired with a mentor, and that they hook up from time to time, and again with a focus on guidance and support and away you go.
You will have participated in these programmed mentorship relationships. What contribution did you make to that relationship? I mean, particularly, I suppose the biggest anxiety people tend to have is time. Did it cost a lot of your time?
Again, quite variable. And most of the involvement that I've had has been an informal relationship with people. And that kind of happens, it can happen without any structure or any defined time commitment. I mean, you meet somebody and you kind of in the car park and you say, how's it going? That issue that you had, trying to get housing, trying to find schooling for your kids, has that been sorted? So that kind of can happen on an ongoing, and you don't notice that there's a time commitment in that. Meeting somebody, it could be something like 10 minutes, once every couple of months, once every 3 months. So I think, again, the time commitment doesn't need to be great, but I mean, there will be occasions where you actually do need to sit down and spend an hour or more with somebody as you help them to go through the issues that are impacting on their transition to a new culture.
My very last question for you, Paul, is you've spoken a lot about the benefits that a mentee might expect from a mentorship program, and you've been a mentor now for large portions of your career. Have you benefited from being a mentor?
Of course, John, I mean, anytime there's an engagement between two people, both go away, I think, having gained something from it. I mean, there is the warming of blow that you've kind of been able to give something back to somebody. That people, often appreciate the advice, not always, but often appreciate, whatever guidance and whatever support you've been able to give them. Again, I think one of the things that has sustained all professions in the medical profession over the decades and the centuries is the notion that we're all in this together and we're all kind of there to help one another. Everybody goes through a period in their career where they just do need somebody, perhaps at a more senior level, who's able to help them. And what we're talking about, I think, is to formalize that to some extent, so that you ensure that it happens, but not to formalize it to such an extent that it becomes a burden either for the mentor, the mentee, or indeed the organization that's trying to make sure it happens. So what I would say is that the challenge might be to develop a level of formality around all of this, but not to drown it in bureaucracy.
I think that's a very good place to leave it. Thanks very much for your time, Paul. I appreciate it.
Very welcome, John. Thank you.